and the lymphatics, they simply go to the deep cervical nodes. Then we are left with the last topic, that is parathyroid gland. They are four in number, both on the posterior aspect pairs. The thyroid, parathyroid glands are present. Superior parathyroid gland are present near the middle of the thyroid gland, and the lower ones are near the lower pole. The upper one are originating from the third pharyngeal arch, and they are very constant in position. They are usually at the level of first tracheal ring, and they usually present within the pretracheal fascia embedded in the thyroid gland. But the inferior ones, they have to, sorry, superior parathyroid were from fourth pharyngeal pouch, and the inferior parathyroid gland, they're from the third pharyngeal pouch. Embryologically speaking, they have migrated a long way, and due to this long migration, they have a very variable pathway, very variable location, both on the depending on the height and embedding in the fascia. It is present at the lower pole of the thyroid gland, and sometimes above it, sometimes below in the mediastinum, and it may be present outside the fascia, inside the fascia, and even within the gland also. And it's all the lymphatics and arterial and nervous supplies is similar to the lower part of the thyroid gland, that is the inferior thyroid gland and deep group of cervical lymph nodes. Thank you so much for listening. Please forgive any latency on my part and any mistakes if I've made, and do mention those in the comment section. If you have any further queries, suggestions, feedback, please do mention in the comments below. Inshallah, we will meet you tomorrow with the next lecture of face, scalp, and the spaces around that region. See you then, inshallah. Allah Hafiz.